All right, so this is Candace Johnson, and I am here to give you my dosage calculations and med calc crash course. Okay, and I'm hoping in under an hour to be able to give you a quick primer on all things dosage calculation. This will be for both the NCLEX-RN as well as the NCLEX-PN. All right, well, first I want to just quickly review for you the question types that are on the NCLEX. These are the next gen questions, and we also have our classic questions here. And you'll notice that I'm not going to go over each type, but you'll notice that there is a specific type here, the fill in the blank style question that we're going to be focusing on primarily today, where you're going to probably more than likely have to actually complete a medication calculation formula of some type in order to answer the question correctly. Usually, though, on the NCLEX these days, when you're having to define something or having to calculate something, it's usually a piece or a portion of a whole scenario that you're pretty much using your critical thinking skills to address. Okay, so without further ado, let's focus in on that style of question. So here is an example of a fill in the blank question here. And by the time we're done with this lecture, we should be able to answer this type of question. If you're an RN taking the exam, all right, the NCLEX-RN, then we're going to, be working with IV or parenteral meds. However, if you are taking the PN exam, there, I'll tell you the differences as we come up here. But this is the kind of question we'll be working with: the fill in the blank style question and the med calc and medication uh, calculation questions, dosage calculation questions. Those are going to be the ones you're primarily answering with these. So, uh, IV flow rate, did I mention that? Determining I's and O's, that could possibly be a fill in the blank question. And then we also have arterial blood gases, which we're going to work on in another brief talk, but we're going to focus in on this talk on the fill in the blank med calc questions. Usually you're having to follow very specific instructions, all right, to the letter. And the final unit of measurement is always given to you. So you don't have to really worry about units on the NCLEX in general. All right, final unit already given you. That's also a good thing for helping you to deduce the correct answer based on units if you know the unit cancellation method, or if that's one of the ways you can get to the correct answers. All right. If you're already familiar with that method, it's great to have the final unit. It can help you kind of fill in the piece of the puzzle. All right. So, on the NCLEX, an on screen calculator is always provided. All right. So, you don't have to worry about that. And usually, when a calculator is provided, it's, you'll find that the questions aren't usually overly complex. It's about you knowing where to plug and chug those numbers into formulae that will actually get you to the correct answer. All right. Remember, on the NCLEX, only the number goes into that box that we saw, that rectangular box we saw for those fill in the blank style questions. Only the number, not the unit. All right. Or it won't be correct. I think it'll allow you actually to put more than a number in there. So it's going to be on you to know that. Round the answer as the question specifies. It kind of goes back to this idea that you're following very specific directions on these questions. There's not a lot of room for gray areas. So really focus on the very last piece of that question that's asking you something specific. Okay, so round the answer as specified. Include a decimal when appropriate. All right, so definitely want to keep up with your uh, doses dosages that are higher than one, right? And or higher than a whole number, right? But can be dosed in, partial doses, or um, doses that have to be kind of like calculated by weight. For example, in our patient. So there might be several different reasons actually why you might need to include the decimal. So make sure you're doing that when appropriate. All right, you do need to have a good grasp on unit conversions. Yes, you do. You absolutely need to know where to apply the proper unit conversion in order to get to the correct answer. And not always will NCLEX, give you the hint you may need to get to the proper unit conversion. So you're going to have to bring some awareness of that in. So with these questions, you're not going to estimate. Now, I've mentioned before how there will be times where you can use your common sense. And by common sense, I mean that knowledge that the average nurse graduating from a nursing program and about to enter the nursing workforce would know, right? So average would be about 51% is about average. Well, that's the passing standard for the NCLEX. So you definitely want to be able to know that. But for these questions, you cannot just depend upon your ability to estimate or to use common knowledge. You really do need to know the formula and you do need to be able to calculate things. All right. All right. So here are a few important scenarios here that are going to set you up well for what you need to know. All right. And by scenarios, I mean some conversions, some dosage calculation conversion rates, but then here also a couple of important calculation formulas that may guide you along the way. Now, this first one we all know and love. It's really going to get you through there on most of your NCLEX questions, if I'm honest, right? Especially most of your dosage calculation NCLEX questions anyway. All right, desired dose D over amount on hand H times volume V. All right, and that volume could either be in, you know, milliliters, or there could be that V can sometimes mean vehicle, referring to the route that the medication may be given. Not always the route either, but the formula, the formulation of that medication. All right, so you could be giving a medication that's not necessarily in liquid form, but maybe in a PO pill, maybe one tablet or one capsule. That could also be the what the V might stand for, right? One per tab, it would be times one tab, okay, for the vehicle. So keeping that setup, D over H times V, in mind, you should be able to answer most of the questions that you'll be presented on the NCLEX that could get you to the proper answer, all right? And then you could take that and further use your critical thinking to solve any additional questions or scenarios presented to you, okay? So it's really a setup on the NCLEX that I want you to prepare for, not just a straightforward question where they're going to ask you to provide the dose when they give you the desired over the amount on hand. All right, it's usually part of a whole. That said, there's your basic formula. Now, there's also a formula whereby you might want to know how to calculate the number of drips per minute, or uh, which would be GTTs per minute. We'll talk about that. But then also how to calculate IV drips in micrograms per minute. Okay, I don't love this formula for getting you there. I'm going to show you another one as we move a bit further in here. But do you or can you keep, all right, together the conversion rates that take you through a typical dosage calculation? All right. Are you familiar with the the rates or the conversion rates? All right. Well, we'll talk more about it as we get into practice because it's a little sometimes tougher for me to explain uh, without actually taking you into a practice example. All right. So let's get down here to the dosage calculation conversions because these are essential ones. All right. And if I can get you to thinking about the essential ones, I think you'll begin to think of others that could be helpful for this test. All right, we know that 1 milligram equals 1,000 micrograms. This is one of the most important conversion rates that you will need to know, right? That 1,000 mics equals 1 milligram, because there are certain formulas, or, well, certain medications, or pharmacology is the word I was thinking of, certain pharmaceuticals that are commonly administered in micrograms, right? When compared to the majority of our meds, which are generally administered in milligrams, all right? For example, Synthroid. That one typically comes in microgram doses. There's also digoxin. It tends to come in those micro doses or microgram doses. And when you see that, you might think, when you see a large number, because look at the conversion, 1 milligram is like 1,000 micrograms. So when you see that your digoxin is coming in at, I don't know, 100, let's see, what's a good microgram dose for digoxin? Perhaps it's 500 micrograms, all right? And you see that, and you have not properly thought in your mind, well, digoxin is one of those meds that comes in micrograms, so that 500 doesn't throw me off at all. It makes perfect sense to me. Maybe you haven't even made the conversion to 0.5 milligrams, so you're sitting there thinking, well, this is a big dosage. I might need to reduce this dosage, all right? Or maybe you think, oh, well, micrograms are so small, 500 might not be enough. 0.5 milligrams, perhaps this patient needs more than that. All right. Well, if that's the case, then you aren't thinking through the proper dosage calculation. All right. So make sure this is one that you have handy. All right. Another one that might be important is 15 mils equals 1 tablespoon. 15 mils equals 1 tablespoon. Keep that one handy. We'll have some practice with that one. 30 mils equals 1 ounce. Okay, that's one we want to know. What else equals 30 mils? Can you think of another important volume that's 30 milliliters? Urinary output hourly for the typical adult. All right, I don't mean typical, but that's a nice normal range for urinary output hourly. 30 mils, so about an ounce of urinary output hourly is what we're doing. All right, and you do know that the bladder holds about 500 milliliters of fluid. All right, 4 to 500. That's depending on, size. All right, so we're just kind of getting some estimations of volume so that we can have a bit of a sense in how to convert them if you're not accustomed to thinking through volumes this way. All right, because NCLEX might just present something to you and you'll have to use a little bit of common sense and then a little bit of conversion. 8 ounces to a cup. All right, are you aware of that? Is that something you just have locked in? NCLEX won't tell you this. This is something you need to bring to the table. 8 ounces equals a cup, because patients like to speak in ounces where in cups. I'm sorry. Patients like to tell you they had a cup of coffee, or that they are going to have a can of soda, right? Or they might say that they had 2 cups of water. Okay. Well, they're typically speaking of 8 ounces. And honestly, we're usually in the medical field and in our teams, we're talking in milliliters. All right. The metric system is what we use in medicine. So milliliters. All right. So we won't even say, how many ounces did you have, Mr. Jones? Most patients do know that 8 ounces equals a cup. So you got to make the conversion. Okay. A patient says they had 1 cup of coffee, then you know they had 8 ounces of coffee. And if 30 mils equals 1 ounce, then 30 mils, all right, times 8 ounces will give you 240 mils. Okay. So knowing how to convert that 1 cup into the number of milliliters will be important, all right? Because there will be times where you'll be asked to think through I's and O's, intake and outtake, all right? How much urine was in the hat, all right? And sometimes they'll have, other comparison data in the question that might be presented in units that you have not yet converted to. So make sure you have the basics listed here. All right. So, some more unit conversions or another table for us to examine when talking about unit conversions. And as I mentioned before, we're looking at the metric system in healthcare, generally speaking. So that's going to include your micrograms. And remember, a microgram looks like, all right, in grams, all right, you're, you're going to move 1, 2, 3, 4, 5, 6 whole uh, decimal spaces. But how often are we giving a patient a gram of something? Usually we're working with milligrams with our patients and micrograms. Very rarely are we giving a patient a gram of something, which is 1,000 micrograms. So we typically live in the milligrams. We tend to live in the milligram and microgram dosage arena, right? We're hanging around those areas there. I can't think of too many things that we would measure in grams. Now, kilograms, maybe a child in terms of size. We might measure a child in kilograms or even an adult in kilograms for that matter, because we are using the metric system typically. So, yes, you will need to be able to convert kilograms to pounds. So, 1 kilogram equals 2.2 pounds. That is definitely a conversion you need to have under your belt. Okay. So, I would say the two here in the metric system that matter the most are going to be kilogram to 2.2 pounds, and that our milligram equals 1,000 micrograms. That's going to be helpful. All right. A milligram equals 1,000 micrograms, or a measurement here that, all right, looks like 1,000th of a gram. Okay. That said, household system. Uh, Now that's how people talk about their volumes and weights in the field, in the community, in the patient's home setting, right? So you sometimes have to be the one to convert as the nurse, right? You need to convert what they're telling you in terms of their household measurements into those metric equivalents when you are going to basically report to the team or report, you know, yeah, to other members of the team. So you knowing the equivalents are great. However, you also need to be able to go back and forth between household and their equivalents, because the household volumes and weights are how you might be able to better teach your patient how to go home and better care for themselves. So often management or patients' self-care, right, or your discharge teaching that you're doing will typically have you teaching your patient in their units that they can understand. Okay. So if the patient says, if you want the patient to take 16 drops or 5 mils, all right, of something, you're going to describe it in teaspoons. All right. 3 teaspoons equals 1 tablespoon. All right. 15 mils. 2 tablespoons or 30 mils equals 1 ounce. We mentioned that before. Okay. Now here we are at 8 ounces or 240 mils equals a cup. And then 16 ounces or 480 mils a pint. But how often do you administer a patient something that's, or have the patient administer something at home that's around the 16 ounces? It's a possibility, depending on what you got going on here. But there's an equivalent there. And 2 pints equals a quart. But honestly, I'd hang out here at the top four, knowing that 5 mils equals a teaspoon. Definitely 3 teaspoons or 15 mils equals a tablespoon. 2 tablespoons equaling 30 mils or an ounce. And then this 8 ounces equaling 240 mils or a cup. These are really good to know. Those are really helpful to know. Now, again, 2.2 pounds equals 1 kilogram. That's a conversion that could come in handy as well. So we have looked at this basic dosage calculation formula, D over H times V. That gives you the dose, usually helpful with PO meds. All right. Uh, I'm going to I'm just going to mention here, without, I don't want to confuse you too much. I don't want to, we'll come back to the ideas here, but I don't want to confuse you too much. But let's just say here what's important about administering a patient a medication IV, and this is for my RNs, okay? The IV rate is typically in milliliters per hour, right? That's the typical IV rate that programs the majority of IV pumps across our nation, okay? So whether it's Cardinal or what's another good IV brand? The one that I use the most, oh, the name just left me. System Q. Oh, well, no matter the brand of IV pump, you will be administering your medications in milliliters per hour. Okay? Milliliters per hour, if you're using a method of keeping up with your units where you are able to cancel out units that are like units, particularly those that are in a denominator, as you see the 1 hour here, and a numerator, as you see the 1 hour here, right? Those two would cancel out. So how might that look? A medication is being given in a certain amount of milligrams per a certain amount of milliliters. Let's see if I can get my markup tool here to just put a shape around here in the color. All right. So if I just started here, or more importantly, here, looking at milligrams per milliliter. All right, any typical medication could come in this formulation. All right, and then I want to give this patient a medication and kind of figure out the right IV rate to administer it in. All right, then I'm going to have to think through the units where I start in the number of milligrams per milliliter, and then cancel units along the way until I get to the desired IV rate. I guess that could be better there. The desired IV rate, which would ultimately be in micrograms per minute. All right. Is that fair game for NCLEX? Actually, it is. Okay. Actually, it is. So let's go here with a little better markup tool. All right. So if we start out in milligrams per minute, all right. I'm sorry, milligrams per milliliter. All right. And we ultimately want to get to micrograms per minute, then we do know that 1,000 micrograms per milliliter, if that's usually the formula is going to give you a piece of the pieces of the puzzle that would fit in here. Typically, you will get your information in the formula. And again, it's easier to describe using a practice question than describing the scenario about conversions here. So let's move forward so that I can demonstrate this to you a little bit better. Okay. All right. So advancing to the next slide. Remember, milliliters per hour represents the IV rate. All right, it's total infusion volume over total infusion time. So it's a matter of volume over time. All right, heparin infusion rates will be important for my RNs as well. But again, if you're dealing with heparin infusion rate questions, you are moving through the NCLEX with some challenge, and you're probably meeting the challenge if you're seeing some of these more challenging questions. So knowing how to work your way through the unit cancellation method might be helpful when you get to those places in the NCLEX where things get a bit more specific, all right? Heparin infusion, that's like titration. So it's a little bit of thinking to do. And then there's also this formula that is fair game for both the RN and PNs called the drops per minute or GTTS per minute formula, okay? And usually it's for IV piggyback medications where you're going to be giving a certain amount of medication in minutes, less than an hour. So if usually the total infusion volume over total infusion time is represented as milliliters per hour, then you're probably working with a standard IV pump that is administering based on the programming, okay? Milliliters per hour. But when you're working drops per minute, you are giving a medication in under an hour. So they're specifying how much this patient might get depending on the tubing, because the tubing might be micro tubing, macro tubing. The drop factor has to be given to you for you to know how many minutes you're going to be giving this IV piggyback medication. It could be a pain medicine, it could be an antiemetic, but on the NCLEX, if a PN is administering a medication parenterally, it'll be this IV piggyback administration. And it will be, then the question may very well ask you what you expect, if they give you any pieces of this puzzle here, what you expect the drops per minute might be. Maybe they ask you what the total time of infusion might be. Perhaps they ask you how much, in terms of volume, will be administered into the patient. Okay, so it's a puzzle to figure out, but those are your four pieces. We'll have a question momentarily that will ask us to break down that setup. Okay, so total infusion volume times drop factor, all divided over the total time of infusion in minutes. Know that formula. All right, and then finally, we have the child's dose. Have you ever thought through those questions where they give you a normal adult dose, right? Then they tell you the child's body surface area, and then they ask you what's the child's dose. Well, if you don't know this little conversion factor here of 1.73 meters squared, not cubed, meters squared, right? Then you might say, I don't exactly know how to get to the correct answer. So memorize 1.73. It's a conversion factor that will help you get to a proper child's dose when you are given the normal adult dose, and the child's body surface area, which tends to be given in meters squared. All right, canceling out those meters squared and giving you the milligrams based on that unit. Okay. So I hope I'm triggering some of what you know about your calc, or what you learned back in nursing school around medication calculations. I hope things are, or the way I'm describing things, are reminding you of what you need to bone up on or study. Okay. So here are our formulas of choice that we're going to be focusing in on. I know I told you a couple, but I want you to hone in on what's inside the blue ovals. Okay, so basic dosage calculation. Know this formula. If you know nothing else, know D over H times V gives you the dose. The PO dose, usually we're talking about tablets, capsules, maybe reconstituted medications, what those powder formulations where you have to add water and stir. All right, so those are basic dosage calculations. Those will get you through those types of questions. Now, drops per minute formula. This will be great if you're administering a medication, IV piggyback, and they give you the drop factor, infusion volume, and or total time of infusion in minutes. All right. So it's what I call a plug and chug. When you know the formula, all you're doing once they give you all the information is plugging and chugging. All right. And you plug and chug, use the calculator, do the proper mathematic calculations, and you'll have your answer. All right. And then there's child's dose formula, where you can deduce the child's dose if given the normal adult dose and the child's body surface area. All right. Just knowing 1.73 meters squared will get you there. All right. And heparin infusion rate, just know that when you're administering heparin, and we have a couple of practice questions where we'll get to explore that. When you're giving heparin, okay, you are going to you're going to think about the total volume, all right, in the bag, all right, in the IV bag, but you also, more importantly, have to think about the number of units. And just remember, heparin units, they come in these thousands, right, in denominations. And so often people get really thrown off when they see these large, huge numbers describing the number of units of heparin someone's getting. all right, in the IV bag. Well, don't get thrown off, okay? You just realize that heparin units come in these large denominations, much like thinking through micrograms. If something's administered in micrograms, it's probably going to be a larger, in terms of the number, a larger number that you're used to seeing when looking at your typical milligram doses. But you have to remember it's in micrograms, so you don't get too excited, right? Well, the same thing goes for heparin. Heparin's going to come with many thousands of units, all right? So don't let that throw you off, all right? And when you come over here, you're making sure you're knowing how many units are in each IV bag while determining the volume of that IV bag. And generally speaking, from there, you can use this formula to figure out either how many milliliters per hour the patient is getting their heparin, all right, the heparin infusion rate, or how many units per hour the patient is receiving their medication. And all those can be determined based on how much information you get in your formula, all right, or in your question, in your NCLEX question. I have a couple to demonstrate how that might look for you. All right, so dimensional analysis. Do you know what this is? I'm going to describe it to you super quickly. And because, I found two types of students, two camps, right? One type of student uses dimensional analysis and it gets them through all types of questions because they have an understanding of the way to cancel units out until you get to the units you want. All right, generally under the idea that the number of units you have are usually multiplied by some rate, some known rate. All right, a rate is just a numerator divided by a denominator, or a numerator over a denominator. So whatever that rate is, it could be the infusion rate, it could be the conversion rate of pounds to uh, kilograms, all right? But there's some rate that you use, and you multiply that again times the number of units you have available, amount on hand, number of units on hand, right? So you know some number, you multiply it times a rate, all right? That usually includes the units you want, all right? Over the units you have. And then you're going to end up with, because you're able to cancel here, units you have in the numerator, right? Times the units you have in the denominator, and you're going to get to the units you want. That's dimensional analysis, also known as the unit cancellation method. All right, so that's the pattern. Do you apply it? Okay, well, let's take a look at this example. And I'm going to demonstrate to you two ways to solve this problem. One way will be through the unit cancellation method. The other way will be through the formula that we have learned about PO dosages. Okay. So I want to guide you through it without exactly telling you all of the correct responses right away. I want to give you a moment to think through it for yourself. All right, so I will talk about it, and then you will, it's perfectly fine to talk to yourself, to answer out loud if given the opportunity. All right, so I'm just going to give you that time as we go. Feel free to also pause as needed. Okay, so I'm going to read first the question. Okay, a patient. Oh, let's see if I could focus in on here. All right, a patient is receiving. Oh, I didn't mean to get my first one going there, but a patient is receiving 160 milligrams of methylprednisolone, okay? And that's called Medrol. They're getting it IM or intramuscular every 12 hours. You have on hand two vials that each contain 125 milligrams per 2 milliliters. All right, we've already got us a rate. All right, how much will you draw into a syringe? Fill in the blanks. Round the answer using one decimal place, and the answer will be in milliliters. That's my way of showing you what NCLEX will always give you in the fill in the blank question, the units. They always give you the units. All right, so I've already gotten you started here. We're trying that out and see what that's like, okay? But I also noticed that I advanced the slide more than I wanted to take it. So let's see if we can get it to just jump back a couple here. All right, so the patient is receiving, and that's a bit distracting, so we'll stop the fireworks. We'll stop the fireworks, okay? All right, so a patient is receiving 160 milligrams of methylprednisolone or Medrol IM every 12 hours. All right, so is receiving usually gives you the indication that this is the desired dose. All right, because administration, quick second here to talk about terms that will indicate correct and proper scope of practice. All right, PNs and RNs administer medications. Usually, physicians or MDs will or healthcare providers will place the order for the medication. So ordered it implies that this is the desired dose, right? Or if the word receiving is receiving, all right, implies that this is the desired dose, or the expression you are to administer, all right, that also refers to the desired dose, because what those words is receiving and administer imply would be that this is ordered medication and this is in fact the desired dose. Desired by whom? Desired by the person who ordered it. Okay, so the physician or the nurse practitioner or the the diagnosing healthcare provider. Okay, so the patient's receiving that, meaning that's the desired dose, and they're getting it every 12 hours. So we have on hand, which will be the next piece of information, 125 milligrams of this medication, all right, per 2 mils. So when you see 125 milligrams on hand this way and they give you per the volume, then you know that means times, okay, 2 mils times 2 mils. That's the same thing. 125 milligrams per 2 mils is the same thing as 2 mils per 125 milligrams. So you can set it up both ways. All right, so the question is, how much are you going to draw into the syringe? Well, the next thing to do here is to cancel these units, milligrams. That's the first thing you want to do, is decide how many units you have. Well, I don't want to go over into the unit cancellation method. I just want to encourage you to cancel units whenever you can. And it's obvious here that you can cancel the milligrams in the numerator and denominator of this formula. Okay, and that's going to leave you with a volume or the desired unit, which is described in the NCLEX generally by the unit that is before you, all right, or presented to you or provided to you. All right, so good. We have canceled to the point where we've gotten to the units we want. Now all we have to do is the math. Multiply straight across all the numerators and then divide by all the denominators. So you'll get 160 times 2 divided by 125 milligrams, which will give you a 2.56 milliliter answer. Now, is that what you're going to put down here as your final answer? Well, it depends on what you're being told in the question. Okay, the question wants you to round the answer using one decimal place. All right, well, here our answer is in two decimal places. So what do we need to do in order to put it in one decimal place? Go ahead and say it in your mind or say it out loud or write it down on a piece of paper. All right, as I go ahead and reveal our final correct answer. This is to the one decimal place, all right, meaning that you rounded 56 up to 60, went ahead and dropped off that zero here and got 2.6, all right, or 2.60, but we're dropping off that zero. We only need one decimal place. All right, so hopefully your rounding conventions are still with you. All right, if you're a little rusty in that area, go ahead and remind yourself of the proper way to round, because if you do get a fill in the blank question, you do want to get that piece correct, or else you're going to get the wrong answer. If you put in 2.56, that will not be correct. And NCLEX will allow you to enter the wrong numbers. All right. So it's super important, very specific. Follow the instructions for the right answer. Okay. You don't want to leave any points out there that you could be taking home. All right. All right, so here is dimensional analysis, and this is how we might set something up if we were going to explore this through dimensional analysis. And people who feel comfortable with dimensional analysis will every single time use the same method, and it will get them to the correct answer. That said, you always start with the unit that has been provided to you because you're solving a puzzle. So the best way to solve the puzzle is work with what you have. All right. Start with the units you have to get to the units you want. All right. So the units you want will be in mils. All right. So we start with what we have. What do we have? Okay, we have or have on hand 125 milligrams per 2 mils. I like to just put the desired unit or the units we want in the first position. This is going to help because as you begin going through and canceling things away, you should be able to lead with the very first position that you put in place. All right. If this isn't making sense to you, or if this field does not resonate with anything you've ever learned before, just plug your ears. Don't listen to me, okay? But if this is confirmatory for those of you who may already use dimensional analysis, then I'm going to proceed further just to show you how the two different methods will get you to the correct answer, the same correct answer. All right, so first we start with our units, 2 mils per 125 milligrams. We put it here. All right, and then we move on to the next piece, right? Where we're going to look at the units you want over the units you have. So I'm trying to get to the desired dose, 160 milligrams, the units I want. Okay, all right, so it's 160 milligrams per dose. All right, per dose. So I want 160 milligrams per dose of a medication that is 2 mils per 125 milligrams. Remember, that's the same exact thing as 125 milligrams per 2 mils. And so it looks like I can do some cancellation here. I can cancel what's in the unit in the numerator with the one that's in the denominator here. So that's our next move here to cancel out those units. And once again, we are left with the units we desire. All right. And there's only math left to do. So we calculate 2 times 160 divided by 125, which looks a lot like this, doesn't it? And should end you with the same number. All right. And we round that to the nearest one decimal place. All right. So if that was painstaking for you because you get it and you don't need all that additional breakdown there, then I'm happy for you. I feel like there are people who feel strong with MedCalc, and then there are those of us who need a little bit of additional uh, priming or perhaps review. Okay, so definitely. Now let's get a little bit of practice going. We're going to practice with the RN questions because that'll give us a chance to look at both the RN and some PO dosage calculations that would be covered in the PN NCLEX as well. So I'm going to click here. All right, we're on a new screen here. Just make this a bit wider. Okay. All right, so let's just make this large enough to view what's most important. And you're going to want to enter your email. Let's just enter my email here to remind you of how you can get in contact with me at drcommunityrn@gmail.com. That's how you can reach out to me. And depending on where you decide to go ahead and send this email, you'll get your responses and all the rationale and your you'll be able to look at the questions again. All right, if you do it that way. All right, if you send it to me, then I'll just get a copy for myself. So feel free to do whichever you'd like. But you do want to stay tuned after you go through the questions. I'm probably not going to have enough time to get through all of them here. All right, but we will start the process of thinking through how to answer them. All right, and I think I might take a sampling of a couple so that you can see the different types of questions. And then I encourage you to go through the questions on your own. All right, so I don't want to spoil it completely, but we are going to show an example of how you might take a look at these. Okay, don't forget to submit them at the end so you can see your score. All right, so let's just start here with this is a fun one. A patient with HIV infection is receiving 200 milligrams of didanosine or Videx, POBID. The pharmacy only has powder packets with 167 milligrams each to be mixed with 4 ounces of water. So, how much should the patient take? Fill in the blank and record your answer using one decimal place. And see how here I have in the parentheses ounces? That means I want your final answer to be described in ounces. Now, you should only be typing in numbers, all right? You don't need to type in OZ or ounces, okay? So I'm going to get my pen tool here so that we can begin to think about how we might structure this, all right? And then I'm going to give you a moment to think through it on your own, okay? Now, I say with these formulas or formulae, the first thing you want to do is to think, am I going to use unit cancellation or am I going to, do I have a formula for this? All right. All right. Depending on how you want to proceed, you will either look at what's desired versus what's on hand, and you'll make decisions from there. All right. Well, the good old fashioned definition or formula that we might use is D over H times V. Let's always think of that formula first, all right? Because they're asking how much should the patient take, and that's a question about dosage, okay? So with that, what is our desired dose? Well, how do we know what's desired? Is receiving is a good example of the language that indicates what's desired. All right, so we could go to 100 as our desired dose. All right, and that's in milligrams. And we know that because the patient's receiving it. All right, can I get a little more space here? I wonder. All right, and generally the D is over H or the amount on hand. The pharmacy only has powder packets with 160 milligrams each. Okay, so that's what 67, sorry about that. 167 milligrams. Okay, to be mixed with 4 ounces of volume of water. All right, so 4 ounces would be your V. All right. So the first thing we're going to look for is an opportunity to cancel out any types of redundant units. Okay. So those that are redundant would be those that are both present in the numerator and in the denominator. All right. And then what's left to do? The math. 200 times 4 divided by 167. Now I'm just going to we'll do the math on my search bar here. So that would require me to go back and select my mouse. And let's just go with 200 times 4 divided by, that's 800, divided by 167. And that's going to give us 4.790. Okay. So 4.790. Again, for the people who are saying, why is she going so slow? It's painstaking. I will say that I just need for my folks who are I might have lost my crayon here. No, that's not what I want. Um, there we go. All right, then the answer was 4.79. All right, so record your answer though using one decimal place. All right, that's going to make it what? 4.8. 4.8 we might put there. Okay, one decimal place. All right, so I'm going to clear our screen here and we'll just do that one good time, but in the interest of time. But here's where you would type in 4.8. Okay. All right. So do you see how that might proceed? Where you can just lead in with that main formula, D over H times V, and it can go take you a long way. All right. You might use it again for this formula. You have an order for levothyroxine 0.05 milligrams PO. You have on hand Synthroid 100 microgram tablets. How should you prepare the correct dose? Fill in the blank, then record your answer using one decimal place. All right, and the final answer will be in tablets. All right, so here's your opportunity to explore. Think first, will the D over H times V formula work here? And if so, go ahead and start plugging it in. Okay, if that's what it makes sense for you to do. So let's see, the desired dose would be what? All right, we'll just D over H times V. All right, so what's the desired dose? Well, wherever you have an order for something, okay, that's pretty much your desired dose. But notice something, it's in milligrams, all right? So you have on hand Synthroid 100 micrograms. Now, didn't before I say they tend to do this. So if you were to start in with this question, looking at it like 0.05 milligrams divided by what's on hand, Synthroid 100 micrograms, and not pick up on the fact that those units need to be converted, then your math will be wrong. Okay? So be sure to consider what you need to do next here in order to make these able to cancel one another. And if you're using unit cancellation, you will remember the conversion rate of 1,000. Let's see how far we can go. Micrograms per, right? How many milligrams? One. Okay. So you're going to need to do the math here. When you do the math, you should do a certain amount of cancellation or a certain amount of removal of these. All right, and you will end up with a vehicle of one tablet. All right, so that V here is not missed. It's generally times one tablet. So whatever you find here times one tablet will give you your correct answer. All right, so do the math on that to get your conversion rates right, or perhaps you'll convert before you even do this, use this conversion rate. Okay, I don't want to spoil them all for you. I just want to get you on your way. All right, let's move along to the next question because this one will present in drops per minute. And then we'll look at this final one with the heparin question, and then I'll just introduce to you this very interesting one that involves eyes and nose. All right, so you need to administer IV piperacillin, sodium tazobactam, sodium, or Zosyn. Okay, Zosyn, let's go ahead and clear this. Zosyn 3.375 grams in 50 mils of D5W to run over 20 minutes. How many drops per minute do you set if the IV tubing has a drop factor of 15? Okay, fill in the blank and round to the nearest whole number for your final answer. And your final answer will be in drops per minute. Now, can you remember, let's see if we can just quickly go back to the dosage calculation questions that we were looking at earlier. Let's see if I can just go back and pick up the mouse for a second. Now, the one I want to show you would be there it is. Here's our formula. Drops per minute, total infusion volume times drop factor all over total time of infusion in minutes. All right? Total infusion volume times drop factor all over total time of infusion in minutes. All right, let's make our way back to our questions. And get our crayon going here. All right, so let's just set up that scenario there. To get to drops per minute, you are going to need total time. What of infusion in minutes, all right? So let's just give a little expression here. Time in minutes times that's in the denominator, all right? And you have the drop factor. Let's just put DF, all right? And volume is first. Let's just put VOL. Apologies for this terrible handwriting, but this is just your reminder, okay? And that's going to help you there. And the volume is in milliliters. Okay, so maybe we would even put milliliters there instead of volume. Okay, so milliliters, not dosage. Okay, so many people make the error of going right for dosage as if that's going to get them to where they want to be for drops per minute. No, you want to, and often NCLEX will give you more numbers than you need. I'll repeat it. NCLEX will often give you more numbers than you actually need, and it's on you to pick out the correct number of or the correct type of number that will help you use the right formula to get to the right answer. All right, so if you're thinking 50 mils is your volume, all right, to run over 20 minutes, which will be your time. And the question is, how many drops per minute given the drop factor of 15? Well, 15 is your drop factor. All right, so what you'll end up with, drop factors tend to be in drops per minute, all right? So I don't have that here, but GT drop factors tend to be GTTS per minute, just to show you how these units are going to cancel out to give you what you're looking for. All right, so well, you see the minutes in the numerator and denominator will count out, and then you'll have drops per mils. Apologies. That should be mils and not minutes. All right, let me clear that because I don't want the confusion there, and I think I should be able to use the eraser to clear what exactly I need to. We'll fix this up here. All right. Remember, this is to run over 20 minutes. All right. And the drops were drops per, this drop factor represents the drops per mil. All right. So the mils will cancel out and leave you with drops per minute. All right. And when you calculate that number and insert it here into the answer space, all right, you should get the proper answer for this question. All right, moving forward to the next question, we'll clear here. The patient's heparin is infusing at 28 mils per hour on an infusion pump. The bag of fluid is mixed with 20,000 units of heparin in 500 mils of D5W. So calculate how many units of heparin the patient is receiving hourly. fill in the blank, and round to the nearest whole number for your final answer. Okay, so we are looking to find the final answer in units. So are you able to set this formula up in such a way where even if you didn't understand everything you were to know about titration of heparin, you could look at the units present and set them up in such a way that you could get to units, all right, from 20,000 units in 500 mils, right, to the final unit of units. Okay, so 20,000 units. Usually heparin is given units per mils in the IV bag. Okay, so units in 500 mils, units per mil. So what do you think would have to be, oops, that's a terrible U. That's a U. Oh my goodness, that looks so terrible. Let's see if we can clean that up a little bit. Back. Let's see if we can clean that little funny looking U there. And 20,000 units, all right, in 500 mils. So, and it's running at 28 mils per hour, all right. And the question is, how many units would the patient receive per hour? So when we're done with the math here, all right, we're going to be able to cancel out those mils, all right, and end up with something that will be an answer in units per hour. Okay. All right. So that will get you there. And then I just want to introduce you to this. Let's clear here. Introduce you to this interesting question here where you're going to need to know some conversion rates in order to get to the correct answer. So you got a hospitalized patient with heart failure on a 1,000 milliliter fluid restriction each 24 hours. So during the 7A to 7P shift, he has 3 meals consuming a half a cup of coffee with each. He also has 50 mils of water each time he takes his medications at 7 a.m., noon, and 5 p.m. Mid afternoon, he drinks 240 mils of soda. So, how many mils may he consume during the 7P to 7A shift? All right, so it'll be important for you to first convert all these different cups into mils, all right, and get it so that you will be able to compare the proper units, right? And then you're going to want to get the terminology and the wording uh, fairly squared away, because there's a little bit of a trick in the language here that could throw you off, all right? And it has to do with uh, um, I guess I would give it away if I told you completely, so I don't want to give it away. All right, so work on this question, enter it here, and then work the other questions. There's additional heparin questions, there's more PO administration or dosage calculation questions with tablets. There's also another, yeah, there's some more PO meds. There's the one question here with body surface area where you'll get a chance to demonstrate your knowledge of that concept I told you about converting a child's dose from an adult's dose. All right, and then more PO questions, a BSA question. Maybe this question wasn't about BSA, but there is a conversion involved here and some unit cancellation that can get you to the correct answer. This question is the one where they provide you with the BSA and they want to know the child's dose. All right. And let's see, another drops per minute question. And then finally, another PO dosage calculation question where you're going to be essentially making a unit conversion. All right. So the goal is for you to go back here, get my mouse. The goal is for you to get through these practice questions, all right, and to submit them, check your score, and see how much you've been able to remind yourself of your dosage calculation skills. Okay, so you may do this for the RN or PN, and definitely use this set of slides where I've shared the link with you to review this information. All right, and reach out to me if you need to. I'm going to show you on the slides where you can reach out to me. You already have my email if you need to, if you have any questions. All right, so there are practice questions here for the RN and PN, and then there are even more dosage calculation questions here. If you click on this link, it'll take you out to nurses labs. All right, and when you go out to nurses labs, you will see some tips here for working with dosage calculation questions. You'll also see additional quizzes that are available in Quizlet that allow you to look at oral medications, parenteral medications, IV medication dosage calculations, and more IV flow rate calculation questions. All right, so definitely Nurses Labs has a good little section on that might be interesting for you to further build your skills in MedCalc. All right, and then stay tuned for my arterial blood gas interpretation notes, where I will give you a little mini lecture on how to manage your ABGs. Okay, your ABG questions where you're being asked about metabolic acidosis, metabolic alkalosis, respiratory acidosis, and respiratory alkalosis. I'll be happy to dig into that topic in my next lesson. All right, well, take care, and I'll see you next time.